Okay, we're live. Hello, everyone. Welcome to our August Exchange SA chat. We're super excited you are here, and we're very excited to talk with Carrie Gillis and Steph Wyrock on behalf of the education section of the APTA about making the most of your clinical experience. I know we all have clinical experiences through DPT and PTA school, and with that comes a lot of nerves and a lot of excitement, and we're just super thrilled to be talking with the education section, which is the first time that we've ever done an exchange chat with an APTA section. So with that, welcome to both of you. Steph, why don't you tell us a little bit about yourself?
Thanks, Alexis. Hi, everyone. My name is Stephanie Wyrock. I am a physical therapist at Rehab Authority in Thief River Falls, Minnesota. I've been out of school now for a little over a year, and I'm currently the education section social media chair, so I run all the stuff that you see posted on the education section, Twitter, Facebook. That's me tweeting on behalf of the education section.
Great. Carrie, welcome.
Great. So my name is Carrie Gillis, and I'm the Director of Clinical Education for the Physical Therapy Program at UNLV in currently 108-degree sunny weather at 6 p.m. in Las Vegas. And I have the pleasure of working with Stephanie on the committee, on the committee with the education section. And I'm really excited to talk to everybody about clinical education tonight.
Well, I know that everybody on Twitter is just going crazy. There are already a handful of pages here with questions just packed tonight. So everyone, as you're watching, throw out your questions on Twitter using the hashtag ExchangeSA, and we will get those, and we will ask Carrie and Steph your questions. And let's go ahead and jump on in. So Matt Downey asks, any advice on turning clinical internships into potential job opportunities?
Great question. From an academic standpoint, I think from that perspective, I think that clinical education from academics, from the clinical side, from any side, is all about building relationships. And even if you don't plan on working in a setting, I think it's essential to build relationships, because PT is such a small community across the country and even in the world. You never know what connections can lead to the next. And so in terms of, building opportunity to have a job later on, it's mostly about investing in the people. And from a hiring standpoint, when I was working in the clinic, that was definitely something that I watched with students was, how do they interact with not only me as their CI, but how do they interact with my boss? How do they interact with the technicians that work for us? How do they work with everybody in the clinical environment? Are they able to establish meaningful relationships? So I would say probably the best thing you could do is invest in the people that are there.
That is wonderful. Yeah, definitely relationships just can carry you through, as we've seen through all of our mentors in PT. So that was a wonderful answer. So our next question is from Robin Blanc. Thoughts on asking for time off to go to APTA conferences or other conferences, such as she says in here APTA NSC, which is coming up this fall, or Con Ed. Just seems like everything she wants to go to is during those clinical experiences. So what tips do you have for that?
I'll answer this one because I had some experience with this as a student and now currently as a physical therapist. So it depends on the school. I think some schools allow like skip days. And I went to Washington University in St. Louis for PT school, and we're allowed 2 skip days. And I took my skip days every time I had a clinical experience. And usually it was either to go to a conference, and one year I got married, so I took a skip day so that I could get married, which they understood. But I did go to CSM one year over CSM, and what I did was I just emailed first of all, I asked my advisor at school that said, I want to go to CSM, I'm presenting there, is it okay if I go? And she says, well, you're allowed 2 days that you can miss, you just have to get approval from your rotation. So I contacted my clinical instructor and I asked him, you know, I got an abstract accepted at CSM. I'd like to present and I'd like to go. Would it be possible that you would let me go? I'm willing to make up any days. So I said, I'll work on a weekend. I'll work with another therapist. You know, anything I can do to help make up those hours. And he said, oh yeah, that's fine. You know, so I think I worked one extra day, and that was about it. He didn't make me make up the other day because he said it was for a scholarly reason. And I think if you can argue your point and give a good, clear reason why this would benefit you and say, you know, this is a professional development thing for me, and that is on the CPI. So it could go towards, you know, improving your CPI score. So you could always use that as well as a way to kind of get to that clinical, get out of that clinical to go to that conference. So that would be my suggestion.
That's a really good point. It definitely shows your willingness to learn and to get out there and network with other individuals, and that's a really great point, Steph. And that's just awesome that you got to present as a student. I mean, come on, that's incredible. So Kendra Lucas asks, what is the best way to create positive learning experiences on your clinicals?
Yeah, I can offer some thoughts there. I would say that in my experience, I find that students who communicate well are very good at developing their own experience. This is communication through self-reflection, so that's a form of communication. So that's going into your affiliations and making sure that you understand the goals that you want to achieve by the end. Then there's communication with the people that you work with in your affiliations, so your CI, interdisciplinary members of the staff. And then there's communication, you know, back and forth between your academic program. And I would say the biggest, you know, area where students kind of get hung up or they don't have the experience that they thought they might, it almost always comes down to communication. They either are unable to communicate how they're feeling with their CI, and their CI is just unaware. Or they're unable to really establish where they're going, so they don't have a kind of a good plan of where do I want to end up at the end of this inpatient experience, or where do I want to end up at the end of this sports outpatient experience. So I would say communication is vital to that.
And I would agree with that. I think one of the mistakes that students make on their first day is not setting up the communication right away with their clinical instructor. Either emailing before the experience or during that first day saying, you know, this is how I learn, this is what I'm not good at, this is what I am good at, these are my goals, and I really want to learn from you, and I want you to help me in every way, and I want to help you learn as well. So just having that open communication and establishing that day one, I think, is really important. Because in my experience and with classmates that I've had, as well as with other physical therapists that I've talked to who have had students, they said that their best experience has come with students that have come in and set the bar high for them.
Perfect. I got knocked out of that. I think you guys handled that okay, and now I'm back in here, so I was a little bit concerned about that, but awesome. Okay, we are back on, or at least I am. Okay, so let's see. If you don't happen to land your rotation in the specialty or clinic of interest, how else do you suggest making those connections or gaining those skills? And that was a question from Robin Blunk as well.
Great question. You know, there's so many areas of physical therapy practice. It's kind of overwhelming to think that you might get placed in every area that you're interested in, and you know, obviously we want to be exposed to all of those areas. I think again, this kind of goes back to that relationship building. You know, PT school is a really busy time, but believe it or not, there is spare time. There are breaks. There are times when you have more than a week off. There are times when you have a day to yourself. I would say there's nothing wrong with reaching out to your community and trying to build those meaningful relationships in those areas that you have questions about. Really no better way to be involved. Also, I think that the APTA sections can be very valuable in educating people on resources for how to become better acquainted with different settings. So, pediatric section, the neuro section, the orthopedic section, the sports section, I mean, it goes on and on for days. So I would kind of reach out to those entities as well as a student and try to become more familiar with those settings. But get in there is what I always say, and there's nothing wrong with building lasting relationships at any time.
That is great advice. I know we have several students who are members of different sections of the APTA and find a lot of value in that, and I know I do as well. So that's really great advice. So this kind of goes along in the same realm. Carly Risman asks, my first clinical is inpatient, and besides class, I've had no direct experience in inpatient. So what are your tips for being in an unfamiliar setting?
I think that's a great question. You just got to go in there and tell your CI right away, I don't have any experience with patients, and I'm a little nervous, and so depending on how you learn, of course, I'd like to maybe just take a couple days and just observe what you do, and just kind of learn how the flow of the clinic of this hospital goes and kind of what you do with patients or what your preferred method is. And the great thing, especially, you said Carly asked this question, right, Alexis? The great thing about having inpatient as one of your first experiences, especially if it's in acute care, those are the basic skills that you learn as a first year, like gait analysis, transfers, taking a history. Doing some of those more beginner type skills is really a great way to kind of ease your way into a more advanced experience. Or if you're in a harder like outpatient setting, observe taking a history, and maybe on day 2 start taking a history and see what type of feedback your CI has in order to improve that. So my advice is, again, depending on how you learn, maybe take a couple days, observe how the flow goes, and then try to jump in there if that's something that you're comfortable with. And if not, communicate that with your clinical instructor.
Beautiful. Wonderful advice. So Krista Wolf asks, how do you handle a CI who does treatment that you don't necessarily agree with or that may not be up to date as far as evidence goes?
That's a really great question, a question that comes up all the time in clinical education. The way that I approach those kinds of scenarios is, first of all, asking those questions in a way that promotes meaningful discussion. So we all come in with a lot of assumptions, and assuming things is usually not a great way to communicate with your CI. And so when you see that ultrasound, a great place to start is to say, in school we had a hard time finding evidence for that particular application. What's your rationale here? I would love to hear how we're helping patients get better using that from your perspective. And so just kind of, in a kind and considerate way, opening that door for discussion. And sometimes, the answer is might be something that you're not down with, you're not excited about. And at that point, you still have a relationship to maintain, and that person is a licensed physical therapist, and they're administering treatment under their license, and you're treating under their license as well. And sometimes we have to accept things, and you don't have to do it yourself, but you have to be accepting of the way that other people do treatment, because we do things a lot of different ways. And I'll be honest with you, sometimes there are psychosocial reasons for using treatments that might not have a lot of science and evidence behind them. It doesn't mean that they aren't effective for patients. So in my mind, I always try to find the rationale. And if the rationale is psychosocial, great. That's a great reason. That's an acceptable reason. But definitely a really hard topic to navigate. I would love to hear what Stephanie has to think on that.
Yeah, that's a great question, and that actually came up quite a bit when I first started my first job, too. So I think that asking a physical therapist or your clinical instructor why they're doing something, maybe it's probably more after the treatment occurs when you're not in front of the patient, is a great way to understand what their clinical reasoning is. And when I've been talking to other physical therapists, one of the things that they say is that some students that they work with don't have the best clinical reasoning skills. They rely mostly on clinical prediction rules, and they haven't really developed their clinical judgment, clinical thinking. I think that's a great way for you to kind of see how other therapists think. One of the things about modalities, so I work in a private practice, and a lot of the patients that we see do pay out of pocket, and they like to have that extra value of having a modality sometimes in their treatment, whether it be a massage or an ultrasound. And of course, we do it if it's something that would benefit them, not just something that we would do in the clinic. And we have patients that are adherent to their physical therapy program because they get ultrasound at the end of their treatment, or because they get a massage at the end of the treatment. And in a private practice, we're fighting to have patients here. We don't get them directly influxed through the hospital. And so sometimes you have to do value-based care in order to get paid. And that's how the reality is. And that's what I would tell a student if they ask me, well, why are you doing ultrasound on somebody that has plantar fasciitis? And that's what I would tell them. Well, this patient normally isn't it. The only way that they're adherent to their program is if we do ultrasound at the end of treatment, or this is why they come. That's what they've told me. And I would rather have my patients show up so we can do the treatment and get them better during the session and provide an ultrasound and maybe not charge them for it, but give it to them anyway, than have them not even come to my clinic because I didn't give them a treatment that they wanted that, isn't going to hurt them any. So I think that asking about clinical reasoning is a really great way to develop your clinical reasoning.
Beautiful answers, both of you. Really liked hearing what you had to say on that. I think that's a common question with students. We're so into the evidence and we don't have that clinical experience to build off of. So this is all we've got, and when they don't match up, it's hard to really understand that. So that's beautiful advice. So Matt Downey asks, how often do you advise self-reflection during clinicals? Once a day, once a week? Does that depend on the person? What do you suggest?
I mean, part of a healthy PT practice is constant self-reflection, in my opinion. And it depends on, I'm not exactly sure what Matt is talking about, if he's talking about an assignment or, writing in a journal. But at the end of the day, it's enough reflection for you to determine what your areas of strength, what are your areas of weakness, and enough reflection to try to move forward on that. So if for some people that's daily, that's just some people that's by minute. They're assessing everything, and for some people that's weekly, and that's okay too. But I think for a PT student in trying to develop your clinical reasoning, which I also really love that topic as well, because it's such this abstract thing. It's this thing that we don't really understand how to get there, but we're all supposed to get there quickly. I think self-reflection can play a really big role in that. So really questioning everything that you do and having an attitude of, I am not going to prescribe anything to a patient. I am not going to engage in any pathways unless I have a really great reason. And what is that reason? And that's reflection kind of gets you down that road. Also, I'm sure that Stephanie has a much more clinical side to that as well.
Stephanie, would you like to add to that?
Yeah. So I think that we should all strive to do to be people that can do reflection in action. So while we're with the patient, in the moment, we're thinking about what we could do better with the patient. As a student, that is a difficult skill to develop. And even me as a new professional, that is a difficult skill that I'm still working on every single day. So at the end of every day, I encourage you to just take a couple of minutes while you're going to bed or right after the clinic, and just think about what could I have done better today. And while you're with the patient, asking them, oh, well, how does that feel? Or do you feel better when you're doing some type of comparable sign? Why did it get better? Why did it not get better? What can you do differently? Always asking ourselves these questions is really important. As one of my mentors once told me, why? You should always be thinking, why? And man, he would question me. Whenever we would have a patient, he would say, well, why did you do this? Like, this was after the patient. Why did you do this? Well, blah, blah, blah. Well, why? Blah, 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 blah. Well, why? And he would keep teaching me until I couldn't think of anything else anymore. And what I try to do every day in the clinic so that I know that I'm giving the best possible care. So I agree with Carrie. I think that it should go at your pace, but I encourage you to continue to develop it so that you're always asking it in the moment.
Awesome. That's so good. So Tim Rethorn is asking, many schools don't let student physical therapy assistant, we don't let the students contact the clinics directly. So how can we look at sites, and what is it that indicates that, hey, this is a really great site, this is somewhere I would want to go?
I can help with that, definitely. So there's two resources that many PT programs should make available to students. The first is the CSIF. That's the Clinical Site Information Form. This is actually kind of housed within the same system as the CPI. I recognize that not all programs use the CPI, so for those programs that don't, they should have some kind of form that indicates a lot of the characteristics about a site. So for example, how many certified specialists work there, obviously the location, a lot of kind of data related information about the site. So that's one side, so that there's some key elements there. For example, are the CIs credentialed? How many specialists are there? I'm interested in women's health. Is there a women's health specialist there? Those kinds of things. So that's a great place to start. The second resource is the PTSE, the Physical Therapy Student Evaluation. This is something that most programs will have students complete at the end of their affiliation. There's two portions of this form. One portion is kind of, again, describing the physical nature of the site. How many patients do they see on a daily basis? What kind of patients? What are the age ranges? What kind of diagnoses did I see there? And so that can kind of give you a sense of, is that a good fit for me? And then the second portion of the PTSE is, how was my education experience here? How was the instruction? Was I well oriented to the site before I came here? Was the site staff responsive when I sent emails? Did they review my documents before I got there? And so those three forms, so basically two forms, one of them kind of has two parts, are great places to start. Then that helps you narrow it down. Once you've got it narrowed down, then you probably want to talk directly with your clinical education team at the school. We're the ones who are visiting the sites every single month, year. We know the people that are there, and we can tell if it's going to be a good fit or not. So, if you're looking to see an involved population of outpatient neurological, I know right away, I can count 5 places that I can go that would be a great fit for you. So I think kind of those 3 things, reading those forms, and your school, even if they don't participate in those kinds of forums, they should have some version of it that is similar. And then obviously communicating directly with your clinical education team.
That is great. I love that. I haven't heard of those resources. So does your school have to participate in those for you to see those, or is that like a national database?
So the CSIF is part of a national database, and it's where PTCPI Web is housed. So if your school doesn't use that to grade you on your affiliations, then you won't have access to it. We use that for our students, the CPI, and so when they log into their CPI, they are automatically given access to the CSIF.
Gotcha. That's cool. Okay, moving right along, we've got several questions down and several questions to go. Just want to remind everyone on Twitter, if you're tweeting, make sure to use the hashtag ExchangeSA. It helps everyone follow the conversation, and we will get right on to our next question. So Rachel German asks, what everyone feels but no one wants to ask. Always love those questions. So basically, I'm tired of paying tuition to work in the clinic. So what are your tips on getting rid of that slump, that attitude, that feeling?
I'll let Stephanie tackle that one. That's a hard one.
Can you please repeat the question so I have a little bit more time to think about that?
Sure. So it's common to hear with students. I know I hear it a lot on Twitter. People saying, we're paying all of this tuition to go and work for free, basically. Well, not for free, for negative. So while we can't really necessarily change that, how can we change our attitudes about the fact that we are paying tuition for working in these clinical experiences?
I think the best way to think about it, at least what made me feel better as a student, was like I'm learning a lot. I'm learning about how to become a great physical therapist. I'm learning how to apply evidence-based practice into the clinic, and I'm learning how to communicate with people, basically. And it is tough, going to the clinic and working for free. We all have that feeling, but I think in order to really not be jaded by that, we really have to think about it as part of our school. It's part of the tuition that we're paying. We are paying to learn, and that is we should put pressure on our schools to have great clinical sites. If I know for me, what I paid for my tuition, I feel like I got every single dollar out of that tuition. All of my rotations were excellent. I worked very, very hard in order to really do well and to be the best student that my goal was to be the best student that they ever had. And I think that mindset really made me feel like I was getting good value to what I was paying. I think if you go in there and just be like, well, I'm working for free, so I'm only going to work 40 hours, they're not going to see you as a person that they're going to want to hire. If you go in there and you work your tail off, come in early, you stay late, you strive to learn as much as you can, it's going to be you getting the best value for your money and walking out with job opportunities probably from every single clinic that you work at. And so that would be my advice for students is the reality is we're paying for it, and treat it as something that you're paying for. Really learn as much as you can and spend as much time with your clinical instructor as you possibly can.
Wow, that was an awesome answer. Way to tackle that one. That was great. So Bud Langham is asking thoughts on home health rotations in the final year, or really at any point in your clinical experience.
Great question. So this is a really interesting development in clinical education over the past few years. The desire for home health rotations obviously reflects the high level of pay that students can have, stepping out of school. But really, most schools have not regularly offered home health rotations until quite recently. In the past, I know for our program, our rationale for that was that it was difficult to achieve entry level according to the grading criteria, because at that time, years ago, most home health organizations were primarily reimbursed through Medicare, almost solely. And so the opportunity for the student to achieve true entry level under full supervision was hard. Now things are a little bit different. As of right now, we are trying to promote actually establishment of home health affiliations for our students, because we recognize that many are stepping out into the workforce, into those settings. But now it's more doable because we have a more better mix of payers. So these home health, they're not just Medicare anymore. And so for me, that becomes a lot more justifiable to send a final year rotation, but you have to find the right setting. You can't just blindly go into a home health setting. You have to understand what the reimbursement situation is like so that students can actually have the opportunity to practice at an entry level.
Wow, that's really interesting to get the background for that. And so it sounds like we're kind of headed in the direction of maybe more and more clinical affiliations with home health opportunities. Is that right?
I know I can't speak for programs across the country, but I know for our program, we are certainly trying to make affiliations match what the workforce looks like. And it's certainly in our students' best interest for me to set up those exposures and those experiences. So definitely, do I think it's the end all be all? Probably not, but do I think it's a great option? Yeah, I do. Yeah.
Awesome. That's great. So Sarah Groff asks, what are some things to look for and resources to use when planning an in-service during your clinical affiliation?
I think that's another good question. I think you want to talk to the staff and your talk to the staff and your clinical instructor on maybe what's been presented before, maybe a topic you're really interested in learning about, and then doing research on that topic. Or if you've had a really interesting patient case, how can you make a in-service about it? So I know that when I did my first clinical, my in-service was kind of boring. I talked about like falls and balance interventions because I didn't know anything about that, and so it was an interest that I had. But kind of realized as I was working through it that it was probably knowledge that they had heard before. And so then when I went into my second clinical, I looked at an outcome measure that this clinic had never used before, the mini best test. Most of the PTs use per gallon scale, but the research has shown that the mini best test is more sensitive and specific in kind of looking at balance deficits, and especially in people that are maybe not as neurologically involved. So they were really interested to see the data on that. And I think that a lot of clinicians kind of forget about data. And so if you can present about recent data that's been found or a collection of data that's been done in a systematic review, a lot of clinicians will find that interesting. And then in my third clinical, I had a patient who he was a 28-year-old 23-year-old guy who had a ACL reconstruction, and he had a DVT. And so I did my in-service on clinical prediction rules, specifically the Wells rule, on how to watch and look for a DVT in a patient. And that was really interesting for clinicians to see because I talked about the different rules that have been researched and what the sensitivity and specificity of those rules were. And making applicable clinical practice is, I think, the most important bit of it. So if you find something that's really interesting, a really interesting article or data that you find, relate that to how they can translate that into their clinical practice.
That is wonderful advice and much appreciated for me as well because I haven't done that yet, but I'll be doing that coming up on my next clinical, so thank you very much for that. We have a couple of questions from Josh and Ben, both of which have last names that are difficult to pronounce, so sorry about that. But just asking, what are some things that students are doing wrong at clinicals? Well, can you tell us more about that so we can know what not to do, basically?
Yeah, and I would say that very rarely do students, quote unquote, do things wrong. Most of the problems that I end up becoming involved with, or I become involved in some kind of mediation level with, almost always involve two things: interpersonal relationships and communication. So, many students, when they go out onto their affiliations, they rightfully so focus a lot on the science end of the preparation. Knowing numbers, knowing lab values, knowing, certain techniques, and that is really important, and having a level of preparedness is really important going in. But sometimes they forget about the simple things like communicating to your CI that you don't feel comfortable with something, or communicating that something was upsetting to you. Letting the CI know that it's embarrassing when you get feedback in front of a patient, and you would much prefer to have it behind closed doors. These kinds of things are really simple, and usually things that when you give feedback in that kind of way, in a genuine way, so that you can help move forward, the PTs that people work with are great, and they're more than happy to acquiesce to that. And so I would say just that in the majority of cases, it's that either the student or the CI do not communicate well, and it leads to problems. So I would say if you can communicate well in a kind and compassionate way, you'll have a lot of success in your affiliations.
That is wonderful. I love that. It's not necessarily about knowing everything that we've learned up to this point. It's just about interacting in the right way. I love that. So Cindy Rowert asks, what are creative ways to maintain a relationship with your CI after your clinical experience has ended?
I think emailing them every so often is a great way to stay in contact with them, updating them on your job search, what you've been doing in the clinic. I still email my clinical instructors probably once every 3 or 4 months just to kind of give them an idea of what I've been doing. I also am friends with them on Facebook, so that helps a lot too. I know that some clinical instructors may have different opinions on whether they want to friend students or not. But if you don't have them on social media, of course, Twitter is also a great way to stay in contact with them if they have Twitter. But if you don't have them on social media, send them an email every couple of months. I've heard from different sources that every 6 months is a great kind of starting point, and just update them on how you're doing, because I think a lot of times people want to know how you're doing. So that'd be my advice to you: is email them every once every 3 to 6 months and just give them an update on how you're doing, and tell them how much you appreciate all they've done for you and how you're using what they learned, what they taught you, to be the best physical therapist you can be. Because all of us PTs, we like to have our backs patted every once in a while, and I think that's a great way to show them that you appreciate the time that they put into teaching you.
That is wonderful. I love that. So going back to our conversation on communication, we have several questions coming up on Twitter asking about how is it that we can communicate. If you have a student who has trouble communicating with you, what do you do to improve on this? Or vice versa, if you have a CI who has trouble communicating, how do you tackle that?
Yeah. It's not easy because different people have different communication styles. And so, some people internalize a lot of things. Some people think that the right way to do things is to forge ahead quietly and toughly. Some people are very emotional about their communication. So I think a really good starting place for effective communication is understanding that you have to be open to different kinds of communication, meaning that you have to recognize that me personally, I'm a very organized person. So when people communicate with me, I appreciate, quick, efficient forms of communication. And I'm usually not super emotional about that kind of stuff. But I recognize that some students, when they communicate with me, they need that emotional side, and that's uncomfortable for me. But I recognize that, and I at least leave myself open to being receptive to emotional and to at least engaging a little bit in that emotional side. I think that when people see that you're willing to, move in their direction, the communication helps. And I see the questions coming up, and I see people probably have specific questions about specific scenarios, and it's really, when you talk about communication, it's hard not to talk about it in really general terms. So I guess let's say for an example of, things are not going well with your CI. Your CI is, constantly quizzing you and giving you feedback right in front of patients. I think the best strategy is to pull them to the side and be open and honest with them. I always tell our students, you're not allowed to give anybody feedback unless you genuinely care about them improving. And so when you genuinely care about moving forward with a situation, the way that you present that topic is going to be gentle and kind. And I think that when you're really considerate of the other person, communication kind of just becomes an afterthought. It just kind of happens naturally. So I hope that helps a little bit. If there's specific questions, I would be happy to give just my thoughts on it. Trust me, there's a lot of opinions and a lot of different ways to communicate.
Great. Thank you so much for elaborating on that. And Wonderful, wonderful advice. So we've got a couple of questions asking about the optimal student to clinician ratio. Is it best to be 1-to-1? Maybe there's a couple of students to one CI. What are your takes on that?
I think it depends on your learning style. I never had a 2-to-1 clinical, but I know a lot of my classmates did, and they, especially in the settings that had more of a reputation of being a really difficult and challenging rotation, they really enjoyed having that other student kind of ask questions to and bounce ideas off of and have somebody there to help support you. So I think it depends on kind of rotation reputation is, what your needs are as a student, and how competitive you are. You know, if you want to do a 2-to-1, I would recommend probably doing it with one of your friends versus somebody that you feel like you really need to compete against. But again, it depends on kind of your own personality and what your needs are in the rotation.
That's really, really good advice. I like hearing that. Cruz Romero asks, what is the biggest barrier to breaking through that student mindset and transitioning to the clinician mindset?
Great question. I think a big part of that transition is a little bit of experience. So as a student, if you haven't had a lot of opportunity to interact with patients, to guide them through treatment, to interact on that clinical level, I mean, it's just natural that you're going to go into the environment a little bit dependent. And I think that's kind of where, before you show up to the clinic, it's important to communicate kind of where you are, because some students have been a tech for 5 years and they like got the outpatient scene down, like they know what that looks like. And some people did their observation hours for PT school application and that's it, and they really have never had any meaningful interactions with patients, but they greatly desire that. So I would say, that's a little bit of experience goes a long way. And the second thing is that, remember how much you know as a student. Remember the fire hose of information you just drank for the last 2 to 3 years? That stuff is in there. Let it show. There's a lot of things that we can't do, but I assure you there are so many things that you can, and accentuate those until the areas that you're not so great in kind of catch up. So I would say that would be my biggest advice, is get some experience, and that you can't help that too much, and then show them what you know.
Awesome. Love that. Thank you. So Alex Bernard asks, is it okay to bring a cheat sheet with questions during your patient evaluation?
It depends on your rotation and on your CI. I found when I did my first outpatient rotation, I did that all the time. I had a list of questions that I was going to ask the patient, and the feedback that I got was from my CI was, great that you're getting this down, practice it at home, but you have to listen. I think that was probably the hardest thing for me when I started outpatient rotations as a student, was active listening, because I was like, oh, am I asking all the right questions? And the more you practice, the better you get at it. But I thought that starting out, where I had stuff written down, and I would also look at what patients I would be treating the next day, and I would go home and I would make sure that I had a good treatment plan for them the next day, and I had everything planned out to the T, because I didn't want to look stupid, number one, and number two, because I was afraid I would forget something. So it kind of depends on your learning style, your CI. When I did my second rotation, I was in a private practice, and my clinical instructor was like, we have to work for our referrals here, and patients aren't as confident, in my experience, patients aren't as confident in their physical therapist if they are, looking at this paper all the time. So then that's when I have to learn, okay, now I can't use my paper, so now I have to try to transition more into active listening. And so you're going to have to ask your CI if that's something that they don't want you to do. You still might have to do some practice with your boyfriend or your mom or your dad on the phone, just to try to get your history down. But I think that it's cheat sheet is a great way to start, especially if you're really nervous. And I think if you communicate that with your CI, they'll be understanding.
Yeah, I know I can speak from personal experience on that one. I was practicing doing my evaluations with a specific sheet in front of me, and all of my clinical instructors said, "Oh, okay, if that's your comfort zone, if that's where you want to go, let's start here, and we'll work you into the system that we use for theirs, which was on a computer." And so they were really understanding that, okay, I was really nervous to try to find all the right boxes in the computer, and I knew where everything was on my piece of paper. So yeah, it always comes back to communication, doesn't it? Just communicating what you need and seeing what they need and letting that match up. So that's a great question, Alex. So another really good question, what are the pros and cons to having that integrated clinical experience during the first year or 2 years and then kind of moving into the full-time clinical rotation? That was a question from Beth Horn, so I'm really interested to hear what you guys have to say about that.
Yeah, I mean, in my mind, we are, just from a personal standpoint, we are trying very hard to establish those kinds of experiences. So, in my mind, from a student perspective, no cons. At some point, you are going to have to interact with patients for the first time. ICE is a great way for that to happen. For those that don't have ICE opportunities, you're going to do it on your long terms, and it's going to happen at the first time at some point. And so having a good outlook on that is important. I can tell you from a clinical education standpoint, the cons to ICE are the difficulty in setting them up. For each cohort, let's say that you have a class of 35 students, one ICE experience for a class could involve hundreds of hours of securing clinical instructor time on a weekly basis. And that's challenging in today's current healthcare environment to invite somebody that we know that has no experience interacting with patients and to invite them into our critical care unit, to invite them into our rehab facility, whatever setting. So I would say no cons from a student. If you have the opportunity for ICE, I hope you make the most of it. From an establishment standpoint, so that students can kind of understand that there are some logistics and semantics that need to be handled from that point of view. It's a struggle and it's a challenge in today's healthcare system, but awesome overall.
That's really interesting, and it's good for us students to hear the other side, because I know my school doesn't provide a lot of that. We have had some, but yeah, I mean, it does take a lot of work of the times that we did have it. It was very, very difficult, and we were very grateful for the opportunity to go there because it takes a lot of work. So our next question is from Corey Langrid, and he asks, what made you want to become a CI? So I'd love to hear both of your answers on that one. It's really great for us students to kind of get in your head as a CI, and so let's hear your answers.
Well,
go ahead.
Well, I mean, obviously I'm a faculty member at a university now, so there's always been a great desire to teach in me. So I've always wanted to teach. The other thing is I had some pretty great CIs, and I was very thankful for their mentorship, and I wanted to give back to my profession in the way that those CIs had given to me. So I guess kind of a twofold, a little bit selfish. I myself love teaching, and I wanted to have that opportunity, and then I wanted to give back to the profession. But I think kind of the more interesting thing that I would like to share with everybody so that they can kind of understand how becoming a CI works is I want people to know that I was a horrible CI my first year, my first couple of students. Part of that was that I didn't get a lot of feedback. I didn't have a lot of opportunity for people to critique my ability to teach. And now that I have gone through several conferences and multiple Con Ed sessions, I've learned so much about what it takes to be a great CI, and I've worked with amazing CIs and gotten to see how they do what they do. But I want you to know that you should seek mentorship for becoming a CI. It's not something that, the art and science of teaching is not something that PTs learn. We learn science, we learn anatomy, we learn the human body, but we don't actually learn, like, how do you teach really well. So I want people to know that if they're interested in becoming a CI and you don't have a good experience at your first go, don't worry. Reach out to your programs, ask for mentorship, ask for feedback, because that was horrible when I first started, and I needed feedback to get better.
And I am not a CI yet. I am only a year out, and my thought is that no student wants to be with a physical therapist that's only a year out of school. So I'm taking the time. I met my mentor here at Rehab Authority has 15 years of clinical experience and has taught a lot of students. And so he'll give me one of his students for a day or two during the rotation, and that gives me an opportunity to kind of help them, and they see a different style because I practice a little differently than him. And just hired a new physical therapist assistant, so I've been using that as an opportunity to help improve my ability to teach. And so my goal is that next year I'm going to take the CI credential course, so I'll have 2 years of experience then. And then once I finish that course and feel ready to take a student, I'll probably take a first-year student and just ask for a lot of feedback with them, kind of like Carrie said, making sure you're asking for feedback so you can become a great CI. So that's how I plan to become a good CI. And if you have any advice for me, I'm an open book.
Awesome. I think that's great that you are open to hearing your advice, because it is that back and forth communication and teaching each other how we both can be better. That just makes for an awesome relationship. So that I'm excited for you in going towards that. And I'm sure there's a lot of students right now who plan to become CIs in the future. So that's great to hear your path that you're going. We've got a question from Brad Thuringer. He is a PTA and is at every single National Student Conclave, and if you haven't met him yet, you definitely need to meet him. But he asked a really great question. Any advice to students attending a clinical experience and they hear that their CI is not an APTA member?
Oh man, I would love to hear the advice too. I really, really struggle with this because I personally really value my APTA membership. I have found that giving the spiel of all of the benefits is largely ineffective. The best approach that I have had success with is basically guilting PTs into it. Telling them that this is who we are, and how can we expect to move forward in the healthcare system as a big player without support for our lobbyists, without support for our legislative efforts. And unfortunately, in today's political climate, that requires money. Where does that money come from? It comes from our membership dues. And from a CI standpoint, I have found, I don't know if people know of the resource called PT Now on the APTA's website. I mean, especially as a student, a fabulous members-only resource for encountering evaluations that you really haven't done before. So it kind of lays out best practice in really bite-sized chunks that you could actually fit into an eval. So of course there's the benefits, such like access to PT Now, access to the online databases and the evidence that we have. But at the end of the day, I really feel like if you don't value APTA membership, then you don't value our place in the healthcare system. So basically, I try to guilt them into it.
No, they definitely are really great resources, and whenever you're using those resources to prepare for your presentations, you can tell them about those resources and show them that. And then whenever you're talking about going to National Student Conclave in the fall, or whichever conference you're at, coming back and telling them about how awesome it is, and just really showing the value that you've seen through that is another great way. Steph, do you have anything to add to that?
Yeah, I've, a lot of my clinical instructors always ask me how I got to do a lot of the things that I got to do, and I would just say I'm an APTA member. I joined Twitter and met a lot of people and have formed a lot of connections, and I think Twitter is the most valuable resource that I've had as a student, and it's really expanded my ability to really take advantage of my APTA membership. And APTA has helped me build my brand, and I definitely wouldn't be where I am today, and I wouldn't know the people that I know today if it weren't for the APTA. And I actually had a clinical instructor who last year during Next, she was flipping through the PT in Motion magazine that she was sitting on one of her colleagues' desk, and she saw like my picture on it with Billie Jean King, because I got to go up and like toss tennis balls out with her or something. And she like texted me this picture. She's like, "How did you get in PT in Motion?" And I was like, "Because I'm an APTA member." And then she texted me about a week later, and she snapped me a picture of her newly membership on her screen. She's like, "Maybe I'll get into PT in Motion." And that was her snap. And so I think Carrie's got a great point. It's really important to tell people about the political reasons why it's important for them to be a member. But just share your story, and tell them that you've never regretted being a member, and that you value paying whatever your membership cost is, and that it's really helped you. And just share your story, because I think people really love to be inspired by passionate people, and if you can be passionate, then they're going to be inspired.
Absolutely. Wonderful answers. I loved hearing both of your perspectives on that. So just kind of going along off of that, with this being Exchange Chat with the education section, tell us a little bit about the education section and why students should join.
So go ahead, Stephanie, you go.
Okay. So the education section is exactly what it says. Education. As physical therapists, physical therapist assistants, and as students, we are constantly educating the general public about what we do. We're educating our patients about why they have pain, why the heck they're doing their exercises, why we're doing immobilization on them. And also, if you're in academia, you're educating students on how they can be the future of our profession. So we're all educators, and that's what the education section is all about. A lot of people think that the education section is for academics, but it's not. I'm a member of the education section because I value the resources that they give us in order to educate our patients, in order to educate the public. And we're actually redoing our website right now to offer even more resources for members to use to help the general public and their patients understand not only what we do, but why we're doing the certain treatments that we're doing for them. And so I encourage you, if you're thinking about joining a section, try out the education section. We want to help you become an excellent educator for policymakers, for the public, for your patients, for your families. I mean, how many of your parents say, "Oh, I'm going to go see the chiropractor today," but you're a physical therapist and they don't want to come see you? Like, what? So having those resources and the ability to educate people on what you do and how to improve their lives is really what the education section is all about. And Carrie can probably speak more of the academic part of her experience as being on the education section. But as somebody who's not a teacher or who's not an educator yet and who is just a new graduate, I found it to be very, very valuable, and I've gotten to have a lot of opportunities to really expand my vision and my perspective of physical therapy because of what I've learned through this session.
That's awesome. Yeah. Wonderful. Carrie, do you have anything to add to that?
Yeah, I couldn't agree more with Stephanie and kind of like the outreach and the purpose of the education section. Another kind of perspective, like Stephanie said, from the academic side, is that physical therapy is the art and science of healing. And kind of the education section is the art and science of teaching. And we as physical therapists are all natural born teachers. We're forced into it because we have to educate our patients and our community and our friends and our family every day. But that science of teaching is not just innate. Some people are naturally good teachers, but there is a science to it and there is a method. And I think that the education section is a great resource to connect, say, for example, people who are interested in becoming better teachers, whether it's a student who wants to become a better teacher to educate their patients, whether it's a CI who's interested in transitioning into a faculty position. I think it's a great way to speak that language, to speak that educational institutional language. So definitely agree with everything that Stephanie said.
That's wonderful. Thank you both so much for being here. We've got a couple of announcements, but I really appreciate both of you being here and talking about our clinical experience. We've gone through several questions, and I'm sure there's some more, so you guys are on Twitter, and I'm sure your phones will have been blown up with all kinds of tweets. So any last words before we go on to our announcements?
Thank you so much for being interested in clinical education, because I'm the biggest clinical education nerd there is.
Thanks for having us, Alexis, and thanks for letting the education section be the first section to team up with you guys and really bring a great chat together to help students really become the best physical therapists that they can be. I mean, we all want to be better than the generation before us, and I think that that's what we all strive to do, and that's what the education strives for you guys to do. So keep up all the great work with the chat, and if you guys have any questions, feel free to contact me via Twitter, and I would be happy to help you out in any way you need.
Wonderful. Well, thank you both so much for being here, and everyone, go ahead and mark your calendars now for the September Exchange SA Chat. It is Tuesday, September 13th, and we are talking with Josh D'Angelo and Ifosa Guabadia on PT Day of Service and National PT Month. So super excited about that, and right after that, on Wednesday and Thursday, September 14th and 15th, is going to be the Flash Action Strategy on the PT PAC. So be on the lookout for that. We've got the Pulse that just came out today. We've got some great information in there. We've got a financial series coming. We've got an article on social media and why you shouldn't join. That one's a fun one. You should check that one out. Advice for first years. That came from a thread on the DPT student Facebook group. So thank you all for your advice that you threw in there. Wonderful article there. And some words of wisdom from Rich Severin and Alexandra Hill, both physical therapists. So lots of great things to see in the August Pulse, and I hope you all got my hints throughout the chat that NSC, National Student Conclave, is going to be awesome. It's in Miami, Florida, October 27th through the 29th, and it's a conference that's purely for students, and it's planned by students. There's a whole planning committee full of students who are planning for the National Student Conclave. And so the advanced registration, basically the cheapest registration, that ends September 28th. So make sure you get your ticket for that and get your PT PAC ticket as well. And we look forward to seeing you all at NSC. So we will chat with you all on Twitter. Keep up the chats. This does not have to end tonight. We can continue this chat all month long until we chat with Josh and Ifosa next month. So with that, I think we are calling it a night. Thank you so much, both of you, for being here, and we just appreciate it. Thanks, everyone, for watching.